Good morning, everyone. Thank you so much for coming today. I'm Marcy Lynn Williams. I'm our volunteer coordinator. I know I'm biased, but I think our Meals on Wheels volunteers are the best in the world. I have enjoyed getting to know so many of you, and I thank you for coming to this training. Your service is really valuable, but also your time is really valuable. To that end, we have a lot to cover. So save your questions at the end. We will have a Q&A, okay? When I prompt you, you have a food transport safety policy. It is crucial that we get that signed and you leave that here today because we want to make our funders happy. Let's get started. So you guys know that you deliver meals, right? But you do more than a meal. You deliver more than a meal. You give them nutritional support. Steady nutrition improves their health. You give them that social connection. How many of you have been out on a route and had a senior ask you for a hug and say, I haven't seen anybody in 5 days? I have. You also do safety checks. And Taisha Jones today is going to be training you in our brand new change of condition protocol, which will launch on July 1st. Okay. She'll be the second portion of the training. But those safety checks are absolutely crucial because you guys know your people better than anybody. And you know when there are changes in their life that MIFA might need to know about. Also, you help them remain in their homes longer. And that's what we want, right? We want them to be independent as long as they want to be independent. You also help improve their health outcomes. We have a licensed nutritionist who plans these meals months in advance. So you really are giving them a very well-balanced hot meal. And of course, all of this combined helps reduce healthcare costs. So thank you. All those client surveys that you guys religiously brought back to us. Well, here's the results. These are the results of what our MIFA seniors think. 22% said MIFA meals are essential to their continuing to live at home. 76% said MIFA meals have improved their independence. And 76% report eating healthier meals because of the program. Now, that's one of our lovely seniors. We have these quotes up on our website and we're putting them on social media. Stories are powerful. Quotes are powerful. Let us know if you have a story. Let us know if you have a client who has a story, because we would love to get with you about that. But one of my favorite quotes is, I am able to cook for myself, but due to health issues, most days I am not. The staff comes by to see me each morning. We laugh and talk, and I am able to have a balanced meal. Now, this is the portion of the training I was talking about, that all-important policy for accepting and transporting food. I'm going to go over everything with you, and then when I prompt you, you can sign it, okay? Food safety matters. You are going to hear all about cross-contamination. It will be our buzzword of the day. You keep your transport vehicle and containers clean. A clean vehicle will help prevent the food that you transport from becoming contaminated. Keep your vehicle clean of dirt and insects. Common sense, right? Food safety matters. Never put food or containers with food near animals. We all love our furry friends. I love coming out and greeting your furry friends when y'all bring them, but always keep those meals separate from the furry friends, okay? You might have a senior with a pet dander allergy, and you don't want to do anything that can maybe trigger one of our seniors or lead to them feeling ill, okay? So when using a car to transport food, consider using a plastic sheet to cover the area where food will be placed. I need to do that in my own car, just with my children. Set up a schedule or a reminder to routinely clean your vehicle to prevent what? Cross-contamination, right. Containers such as coolers or thermal tote bags dedicated to transporting food should be cleaned after each use to prevent cross-contamination. We have that sanitation station outside. We have the wipes. We have the hand sanitizer. If you guys have other items that you'd like us to have to help you clean your coolers or your tote bags, let us know and we'll get that done for you. But please, please use our sanitation station. That's what it's there for. Do not reuse disposable bags to transport food. What we're talking about are those grocery bags that are found on the volunteer welcome cart. They come right out of the box into that container, that bin that I use, into your hands. We want you to use our bags, and we don't ever want you to reuse bags, because what are we trying to prevent? Cross-contamination. Very good. Also, what do I always say? I'm like a broken record. Stop, look, count. Well, we want you to count your hot meals and your frozen boxes and all of your items, because if you're missing anything, we want to get it for you. We have a replenishment cart. We're more than happy, I or my lead volunteers, to get you anything you need. There's nothing worse than being on your route and having to tell your senior, I'm sorry, I don't have your 4 frozen because I didn't take 5 minutes to check. And human beings do make mistakes. So the other reason is because as you are looking at your meals, look at your trays. Make sure the seals are all sealed, that there are no trays that are leaking. If you do have a leaky seal or anything like that, or if you have a problem with any of your side items, maybe one of the bread bags is busted open or something, come to me. And again, we'll get you a replenishment item off of our replenishment cart. We want to keep hot food hot and cold food cold. We want to maintain temperature control of all foods. Now, when y'all are in the hub and you're opening your cooler, maybe you're transferring your hot meals into your own cooler, or maybe you're just counting. Sometimes you guys start socializing, which I love to see. Like I said, we're all a happy MIFA volunteer family. But what is happening to that heat on those trays while that cooler is open? All that heat's dissipating. So just be as quick as possible. If you want to start a conversation, just shut your cooler, chit chat, then open your cooler back up. Okay. Also, we never ever combine a hot tray with a cold bag item. Sometimes when y'all come in and deliver, you've got things in a cold snap bag. It might be a pudding or something like that made by chef, made with dairy. It might be the cut lettuce cup or even cut fruit. You never combine a true cold item with a hot tray. Even when you get to their house, if you use the disposable bag, you put the tray, the bread, the drink packet. If you have that cold item, you carry it separate. If you put it in the bag and you give it to the senior and they say, oh, I'm going to eat in 10 minutes, and they set it on their counter and they just forget about it, you've got a foodborne illness situation in the making, as that hot tray sits with a dairy or a cut lettuce or fruit item. So never, ever, ever combine a cold item with a hot tray. Okay. You use insulated containers to transport hot and cold food. Never leave cold or hot food outside of the container. Food should always stay in the container until delivery. Why? Because we want to keep those hot trays hot as long as possible. Individuals transporting food should take care to prevent cross-contamination. Obviously, hand washing is important. The hand sanitizer, please use the hand sanitizer before every delivery. We have those hand sanitizers on the sanitation station. You can replenish your hand sanitizer here. That's what it's there for. Please use it. And obviously, never deliver meals if you are sick. Most of y'all are so great about that. I can't tell you how many times that you guys have contacted me and given me your symptoms. And what has been my response? Please stay home with our blessing. We will cover your route. Thank you so much for caring so much about our seniors and MIFA staff. This is very important. Never, ever, ever, ever leave food on a porch, doorstep, cooler, or hanging on the doorknob. Give the hot meal to the next client with our blessing and mark extra meal delivered in the app so that we can account for that meal. Return frozen boxes to MIFA for evaluation and reuse. You are not wasting your gas or your time. We are a nonprofit. Every cent counts. A 5-pack frozen is a $50 box. A 7-pack is a $70 box. So you are saving us because we can reuse those boxes. We temp them and we reuse them. Okay. I had a new volunteer last summer, and she was out on her route and her first day, and she called me and she said, Marcy Lynn, I messed up. I said, well, what happened? She said, this client told me they were there, and they told me they were in the bathroom, and they told me they were going to be outside 5 to 10 minutes tops. And they begged me to leave their hot meal and their 4-pack on their doorstep. And I said, and what did you do? She said, I did it. And I said, you just had training 30 minutes ago. I was very clear that you weren't supposed to. She's like, I know, but she was begging me and she told me. I said, okay, well, Okay, what happened? She said, well, I'm done with my route now. It's like an hour or something later. And I happened to drive back by her house and I saw the 4-pack and the hot meal on her doorstep. What do I do? I said, well, you need to take up the 4-pack and the hot meal because we cannot leave that for the senior because that is a foodborne illness situation. It's a dangerous situation. MIFA policy is we do not leave meals unattended. You have to balance your heart with your head. Okay. No matter what your senior says, you have to do what's best for the senior in the long run, which is to prevent any type of a foodborne illness situation. Okay. If they have a problem with it, tell them to call MIFA Client Services. It's called Office in the app. And tell them to, to speak to MIFA about it. But MIFA policy is we do not leave meals unattended. We give it to a person at the address listed on the route sheet. Okay. I know it's hard because they pull on our heartstrings, but we have to do what's best for them in the long run. Now, will you please sign that all important meal transport policy? And leave it here for me to collect. Okay. Today is Wednesday, May 21st, 2025. Remember that program eligibility for Meals on Wheels is based on nutritional and functional need, not income. I always say be the sunshine in their day. I hope that I'm the sunshine in your day when you come into MIFA every morning. You might have a senior who wants to visit, let them be in the driver's seat. You might have a senior who just wants to thank you for their meal and be on their way, but make sure you remain in your delivery window from 9 a.m. to 12 p.m. The seniors are told to be there between 9 and 12 p.m., okay? You want to remain in your window because you don't want them to miss their meal because say they have an appointment at 12:30 or 1 o'clock and they're leaving, right? Or you don't want their meal to get too cold to be able to serve them. So make sure you keep your window 9 to 12. Boy, it's summertime. And so what does that mean? That means it's high crime time. Please, please, please be careful that when you're out delivering, when you exit your vehicle, make sure it is locked before you go up to your client's house. Make sure your purse, your wallet, and your phone is not visible to anybody passing by outside. While you're out delivering, if you are ever in a situation where you feel unsafe to deliver, we don't ever want you to do anything that makes you uncomfortable, okay? Mark unsafe to deliver in the app, and you can call MIFA Client Services and explain what's going on, because maybe they need to know about a situation going on outside that client's house, okay? Unsafe to deliver in the app, and then you can call Office on the app, which is the MIFA Client Services number. And don't pet or feed their animals, even a client's pet, because you never know when you might get a biter. And those small ones are the worst. They are. This is very important. If you find yourself in an emergency with your client, number one, call 911. Number two, then call client services. Once again, it's call Office in the app, okay? You do not move the client. You reassure the client until help arrives, unless otherwise instructed by the MIFA or the paramedics. This is what I've been emailing you guys about. This is a big change, but we're all going to get through it together, okay? I am here for you. Beginning July 1st, meal delivery will be paperless. Eliminating paper route sheets will result in a cost savings of at least $800 per year in printing costs alone. That amount could purchase 177 hot meals. MIFA introduced the Serve Tracker Mobile Meals app in 2017. Currently, we have 33 volunteer routes, and each day there are about 4 to 6 paper users and phone users. Our goal is 100% compliance. I believe in you, and we can do this. We realize this will be an adjustment for some volunteers, but we are here to support you through this transition. Now, we've had some volunteers over the last year that have been very resistant to using the app. They have had one-on-one training with me, and they now use it no problem. Okay, I am willing to help you in any way I can. I wanted to give you some of the reasons of why we're wanting 100% compliance with the app and why we're moving to a paperless meal delivery system. It's more efficient. It's a reliable tool that streamlines both deliveries for volunteers and record keeping for staff. It shares and captures data in real time and eliminates the need for manual data entry. Confidentiality securely stores personal client information. For client confidentiality, use of the app is preferred by our funders and mandated by our leadership. Now, we have had more than one volunteer or volunteer team bring us a stack of paper route sheets and ask us to shred them for them. The policy is if you use a paper route, you're supposed to shred it daily, okay? A stack, more than once. If that volunteer's car or home where they were storing those route sheets had been broken into, they would have given thieves a ready-made victim list. That is another reason we're moving to paperless meal delivery. Your client information will only be found in the app beginning July 1st. It's also cost effective. It reduces cost and waste of printing and disposing of daily route sheets, significantly reduces staff time associated with producing, printing, distributing, and logging deliveries from paper route sheets. So when you guys use a paper route and return the paper route, or you call into MIFA, here's our process. The paper routes, either I or one of the staff inputs that information into the app for you. But it's not your name and your cell number in the app. It's my name or my colleague's name, and then we're signing your name and we're putting our initials in parentheses. That's not what we want. What we want and what we're asking for is for a volunteer to be in the app with their cell number and them signing out so that it's their record of delivering the meals, okay? If you are a call-in, client services takes your information, okay, whether they talk to you in person or have a voicemail, then they put it in an email, and then they send it to me and my colleague, and then we put it in the app. So we're trying to eliminate all that process. When it's the app, it's immediately. It is immediately, okay? The change of condition training that you guys are about to go through is found in the app. What will launch July 1st? It's found in the app. The change of condition prompts and reporting will be available through the app. It's the fastest way to share client concerns with MIFA staff and therefore get results quicker for the seniors. No downside to that, right? So one difference that you will find without having the paper route is you have your hot meal summary at the top, that bar next to the far right, you have a summary. And again, I'll be happy to show you all of this. You have your summary. When you click on the summary, you do have your hot lunch summary. So you can still count your trays, your breads, your drink packets, and your sides, okay? So for instance, this one has 8. So before that volunteer would have left, they would have counted 8 trays, 8 breads, 8 sides, 8 drink packets. Frozen boxes are a little bit different. Do not freak out when you look at your app come July 1st, because what it does is it counts the entire numbers of meals inside the frozen boxes. So if you look and it says you have 36 frozen boxes, you don't have 36 boxes. You have 36 meals in all of those frozen boxes. We will have the frozen box summary, and MIFA staff will actually count your frozen boxes for you before you head out. You no longer have to count your frozen boxes, okay? But please do count your hot meals and all of your items before you head out. The birthday card. You will now have a birthday calendar on. I know, Miss Eddie. You will now have a birthday calendar on the birthday card. That's our lovely Miss Eddie modeling our birthday cards for us. And it'll be by route and name. So your job as a volunteer from now on is to just go and check that calendar, look for your route, look for your client name, grab one of those lovely homemade birthday cards that we have churches and organizations and children make for us, and also grab a cookie and take it to your senior. Guys, I appreciate you so much. Like I said, I really do believe Meals on Wheels volunteers are the most dedicated volunteers in the world. And now, without further ado, we're going to have Taisha Jones, and she's going to tell you all about this exciting new change of condition protocol.
Alrighty, good morning. My name is Taisha Jones, and I am the Senior Client Services Coordinator here at MIFA. And I will be talking to you guys today about the change of conditioning monitoring protocol. It is a way for us to deepen our impact here at MIFA with each of our clients. So background and objectives, Meals on Wheels has always had the approach of delivering more than a meal. Our drivers and volunteers are our first line of defense when it comes to senior well-being. Goals, delivering nutritious meals, in-home safety checks, connecting clients to social programs, and other resources within the community. So what is the change of condition monitoring protocol? It is a system to monitor changes in seniors' health and well-being. It has a total of 7 wellness indicators, which we will get into in a little bit. It utilizes the mobile app Serve Tracker for real-time reporting, and again, it helps deepen our impact. So why is it important? It helps prevent health declines because volunteers and drivers will be trained to notice small but meaningful changes in a client's behavior, appearance, and daily functions. For example, we might come in contact with a client who has confusion or is fatigued or is unsteady on their feet. These signs often happen before a serious health event. Addressing these signs before that will prevent health declines due to early intervention from emergency services. It increases volunteer engagement. Using the change of condition, volunteers will be able to get an insider look instead of an outsider look. You guys will be integrated into our support team. Strengthen our rapport with clients. When staff notice and respond to subtle changes, our clients feel seen, heard, and valued. This builds trust and reassures them that their well-being is important to us. So highlights, using the app, drivers and volunteers have gained the ability to not only indicate when a meal was successfully delivered, but you can also raise an alert about it changing the client's condition. Using the app is the best way to document a client's change and to ensure it is being reported to the client services team. So some highlights, again, drivers will be trained to utilize a mobile app to report any changes. Alerts are automatically sent to the senior coordinator and client services team. The team assesses the alerts and takes necessary actions to address reported changes. And some necessary actions are, we might have to put in a welfare check, which you guys know is a public service from the police who come out and check on our clients who we might have a big concern over. And this process ensures timely response and appropriate care for clients receiving Meals on Wheels. So again, the COC, change of condition process, and the Meals on Wheels mobile app allows volunteers or delivery drivers to report noticeable changes in a client's health, behavior, or environment. Again, ensuring timely intervention, supporting client safety, and enhancing overall well-being. HIPAA and confidentiality, I'm gonna go over some key points. Protected health information. This includes any information that can be used to identify a client, such as health status, medical history, or any other sensitive details. Do not share any client information with anyone who does not have the proper authority to access it. Handle client records, communications, and interactions in a way that prevents unauthorized access. Physical records, keep any written or printed documents with client information in a secure location. If you must transport records, keep them in a locked bag or folder. Digital records, use the mobile app or any secure system provided by the organization for documenting and storing client information. Do not store sensitive information on personal devices. Record and report. Document any changes you observe in the mobile app or other official channels. Always ensure the information is factual and objective. Limit disclosure. Share information only with authorized personnel. Do not discuss the details of a client's condition with others, including other clients, family members, or outside parties. And finally, although volunteers are encouraged to report observed changes in a client's condition or concerns related to wellness checks, MIFA is legally and ethically restricted from sharing any follow-up information related to those reports. In compliance with HIPAA regulations and MIFA's confidentiality policy, we are unable to disclose any details regarding the outcomes, but please be assured that all reports are reviewed and handled in accordance with our internal protocols and regulatory requirements. So this is what it will look like in your app July 1st is not on there yet, but it'll have all of our 7 wellness indicators. And you are able to click more than one. As you see, it's a box, so you're able to click more than one in there. And in additional comments, just be as detailed as possible. So that is what it will look like on July 1st. So these are our wellness indicators: mobility, health, personal safety, self-care, nutrition, home environment, social isolation, and loneliness, and emergency 911.
Now, you guys listen, there will be a quiz. You're going back to school.
Mobility. So mobility refers to a person's ability to move around independently. Some factors that can affect senior mobility could include neurological conditions, arthritis, muscle weakness. Falls are the leading cause of injury, related hospitalizations in older adults. These are some signs that there could be some changes in their mobility. They might have a new limp, taking longer than usual to answer the door, unsteady on feet, recently fallen or have fallen in the last 3 months, or they are having shaking or tremors. Health, it helps us understand the client as a whole person. Health encompasses both physical and mental symptoms. Factors that could change a client's condition could include they're starting a new medication, muscle strength, depleting as we age, cognitive changes. So here are some signs, these are some things to look out for. Apparent changes in mood, behavior, or physical health, unusual breathing, new bruises, muscle weakness, facial droop, change in skin color, confusion, and a new communication problem. Personal safety and self-care. This refers to a person's ability to take care of themselves and as well as stay safe in their home. These signs may indicate that there might be a change in that condition for the client. Some signs would be malnutrition or dehydration, withdrawn behavior, isolation, smell of urine, feces, and disheveled appearance. Elder abuse or neglect. I have both of these numbers on there, so if you guys want to write it down or plug it into your phone, that would be great. If you believe that someone is being abused, neglected, or exploited, please call the Elder Abuse Hotline. 10% of Americans age 60 and older who live at home experience abuse, neglect, or exploitation. Only 1 in 24 cases of elder abuse are reported to authorities. Be their voice, report elder abuse, and make a difference.
So I'm gonna call out the local number for you guys. It is 1-888-277-8366. Want me to do it one more time?
Please.
Okay, 1-888-277-8366. Just like I tell so many of you to go ahead and add the Aging Commission as a contact in your phone, go ahead and add the elder abuse number in your phone, and that way it's always there when you need it.
You report this to them, not to you.
For we're all mandatory reporters. I mean, it's important that MIFA knows too, but also we're all mandatory reporters.
If we call that number, you'll get the message.
Kim,
No. You, everyone in this room is required by law, if they see elder abuse or abuse of a vulnerable adult, like somebody who has a disability. So yes, you should call that number. That wasn't a question. Yes, right, right. Yes, you should call that number. No, they will not tell Marcy Lynn or anybody here at MIFA, but you can, if you want, tell them in the app.
So we consider Mike as an authorized,
No.
any information we have about anything, Mike says authorized. All the HIPAA records.
There's nothing prohibiting you from telling MIFA that. Yeah.
That's just for the elder abuse, that's not HIPAA type information. Correct?
So you are authorized by MIFA to do the work you do, right? And so They are the organization that you report to. So, when you say HIPAA, let's say you found out, gosh, I don't know, that somebody you delivered mail to, Marcy Lynn, had a heart attack last week,
Mhm.
right? You're not prohibited from telling Martha that. You just put it in the app. and-
But Michael is prohibited from telling us anything regarding after the fact.
Yes, they are. That's correct, because that becomes a more private personal.
So we are not Mike in that case. I just wanted to make sure.
Yeah, no, that's right. You're right.
We can reassure you that MIFA is investigating or is responding. We just can't tell you what the result is.
Yeah.
Okay?
And I will also tell you, if you call that number, they will call you back and let you know when they make contact and give you some general information. Again, they won't tell you everything that happened either, but they will call you back.
Mhm.
And so that's reassuring. I know for me, it's reassuring.
But it is not enough if we suspect elder abuse to tell Michael. We must
Absolutely
report.
not. You must report it. Every person in the state of Tennessee is required by law themselves to report any sort of abuse or neglect they identify to an older person or a vulnerable person.
And ladies and gentlemen, that was Kim Doherty. She'll be speaking in just a moment, but she is the executive director of the Aging Commission. So we thank you for jumping in and bringing that clarity. It can. It's a two-process system. You are mandated to report this, but also we do at MIFA want to know what's going on in our seniors' lives. Okay?
And I will say this, if you don't want to tell Micah, you absolutely do not have to, right? Like, there's nothing that requires you to tell Micah, right?
But we'd like to know.
Nutrition, some signs that could be a change of condition with nutrition could be visible weight loss or gain, loss of appetite, turning away meals, and concerns about fluid intake. Since summer is coming around, I do want to add this part about fluid intake. Mild dehydration in seniors can lead to serious health declines. As we age, our thirst response weakens and they might not feel as thirsty even when their body needs water. Also, as we age, kidney function declines and many older adults take medications like diuretics to increase fluid loss. All changes involving nutrition should be reported in that. Home environment. A home environment, when there is a safety issue in a client's home, it can make it difficult for them to be at home safely. There could be a fall risk, extensive damage. So here are some things to look out for if there's been multiple complaints of bugs, pests, or rodents, dirtier or more cluttered than usual. This could pose a fall risk, a fire hazard, and it could be a sign of cognitive decline or emotional distress, unsafe living conditions, and home repairs needed. Social isolation and loneliness. Addressing loneliness is important, not just for emotional well-being, but for maintaining brain health. Loneliness triggers the release of cortisol, and elevated cortisol levels can impair cognition and weaken the immune system and disrupt their sleep patterns. Social engagement strengthens neural connections in our brain. Without having regular social interactions, these pathways can weaken, increasing the risk of dementia to our clients. 1 in 3 older adults aged 50 to 80 reported feeling lonely some of the time or often. Here are some signs to just look out for, or if you hear somebody talking about they reported that they lost a friend, a family member, or a pet, loss or change in support form, caregiver, family, or social network, change in participation in usual social or religious activities, or strained relationships with their family and friends. So how does this deepen our impact? This is our beautiful impact triangle. It may seem like a simple breakdown of services, but it actually represents something a lot deeper. It's our increasing levels of impact. On the top, we have our Claris Companion tablet program. I oversee that program and it connects seniors with a tablet those that are socially isolated, and they create a little community. The My Phone Buddy program is another layer of that engagement with our clients that connects a volunteer with a client for telephone reassurance during the week. The change of condition monitoring protocol is a more proactive layer. It involves health monitoring. Again, the protocol helps us detect changes. It allows us to intervene early and potentially prevent hospitalizations or more serious health issues. And our most visible service at the bottom, which is our MIFA Meals on Wheels delivery. While it addresses the immediate need for nutrition, it also serves as a daily wellness check. Every meal delivered is a moment of human contact and care. So the pyramid shows the impact of our work that goes beyond a meal. Each layer builds on the last, creating a holistic support system that empowers our clients to live more connected and healthier lives.
Here's your quiz.
Now, just a reminder, you can have more than one answer. So it's not just it's C. You can have as many answers.
The
Judy.
more information we have, the better.
Mhm. Judy is taking longer than usual to get to the door today. When she answers the door, you notice that she is using a walker, which is not typical for Judy. Which wellness indicator would this fall under?
See.
C, mobility. This afternoon, Marge's living room appears more cluttered than usual, with dirty dishes and trash are starting to pile up on the porch. Which wellness indicator would this fall under? Let's see. E, home environment. David seems withdrawn and sad today, although he is usually quite upbeat when you deliver his meal. Which wellness indicator would this fall under? So smart. A, health, mental.
And guys, David would be a perfect candidate for a Claris tablet or maybe a My Phone Buddy.
When delivering a meal for Arthur, you have instructions to put the box on the dining room table. You notice that the client has 6 unopened meals on the table and they are room temperature. Which wellness indicator would this fall under?
All of them really good.
We ready?
D, nutrition.
But remember, you can mark more than one. The more information we have, the better. The better we can assist the senior.
B, answers the door wearing the same clothes as the previous times you have delivered meals. You notice a strong odor and you suspect that she has not bathed. Which wellness indicator would this fall under? B, personal safety self-care. Clarence has lived with his daughter, son-in-law, and their 5 children for the past 12 years. He is at a new residence, a 1-bedroom apartment at a senior living community. He told his driver that he really misses seeing his grandkids every day and feels alienated. Which wellness indicator would this fall under? Yes, F, social isolation and loneliness. That's actually a story of one of our tablet users. That's how he got to the program.
Perfect candidate for a tablet.
You notice that Nora's skin is more yellow in color than usual, and she appears to be more confused than usual. Which wellness indicator would this fall under? A, health.
A++.
Upon arriving to the home, you see Robert lying on the ground in front of his porch, bleeding from his nose. Which wellness indicator would this fall under?
G.
G, emergency 911. Betty is usually in a sprightly mood, but has seemed sad and withdrawn for the past 2 deliveries. Betty presents disheveled and is giving off a strong body odor. Another driver informs you that Betty's brother passed away a few weeks back. Which wellness indicator would this fall under?
They have it.
It'd be B.
Yeah.
So you can have health, self-care, or social isolation.
Another perfect candidate for the tablet and My Phone Buddy.
Next steps, train staff and volunteers on new system, implement mobile app across all routes, and of course, continuously monitor and refine the process to ensure efficacy.
And remember, this launches July 1st.
So are those questions gonna, like right now when they have
Mhm.
your prompt and change of condition, right? Yes or no? Do those questions come up if you say no? Is that?
Not till.
If it says change of condition and you say yes,
Yeah.
that's gonna come
I
up.
mean, yes, I'm sorry. Yes, if you say yes, those come up. Cause
Right.
right now there's some different things that come up.
Right,
Those
because
are
the
gonna
new,
change.
the new
Yeah,
protocol will launch on July 1st.
I got it.
So guys, we will have a Q&A at the end, so let's try to hold our questions just a little bit longer. But we are honored today to have Kim Doherty, the Executive Director of the Aging Commission. Let's give her a warm welcome.
Hello. And I'm so glad that you and I know what that means because there's so many people who don't know what that means. But we knew a time when Penny and Shaq were the thing, right? I love that shirt. Good to see everybody this morning. I am Kim Doherty, Executive Director of the Aging Commission. I have the best job because the job I'm here to do today is to thank you all. Thank you all for your service. Thank you for everything you do. Thank you for supporting MIFA, supporting the Meals on Wheels program, and just supporting people in our community who need you. And so it's just terrific to be with you and share a little space with you. They put out a pamphlet for you guys today to give you a little bit of information about the Aging Commission. You know, we have an incredible partnership here with MIFA, supporting the Meals on Wheels program and the Ombudsman program. You guys know a little bit about the Ombudsman program. But the Aging Commission of the Mid-South is an area agency on aging and disability. There are 9 of those organizations throughout the state. This particular one supports people in Fayette, Lauderdale, Shelby, and Tipton counties. There are about 300 of said organizations around the United States, and they're primarily funded by funds from the Older Americans Act of 1965. And through that act, these services are funded. Again, you guys know we primarily support the nutrition program and the long-term care ombudsman program through MIFA, but we also support all of these other programs throughout the community. The Older Americans Act also provided for training and research projects, community service employment projects for older people, and then grants for people who are Native American, Native Alaskans, and Native Hawaiians. Our partnership, you guys know about that, but we provide significant funding for home delivered meals for people who are 60 and older, and also people who are vulnerable, some people living with disabilities under the age of 60. We provide congregate meals in about 15 sites throughout the community, and the long-term care ombudsman program. I know you all are familiar with that, but that program sends people into long-term care facilities such as nursing homes and assisted living, and gives them someone to work through any difficulties they may be having in that particular place. Yes, sir.
Are people under 60 not supposed to be receiving this benefit?
Which benefit?
The Meals on Wheels?
Yeah, so we do purchase some meals for people under the age of 60 here. That's correct. These are people who would be living with significant disabilities. That's right. And then congregate meals, though, is only for people over the age of 60. And just so you know why, the Older Americans Act funding can only support people over the age of 60, and that's what supports the congregate meal program and part of the home delivery meal program. And the state of Tennessee gives us some other money that's just state money to look after some people who are under the age of 60 living with a significant disability. How we work together, you guys know that if a person in this community wants a meal, they call us, we screen them, put them on a waiting list. you guys probably know this, there are about 3,000 people, actually closer to 3,300 people right now waiting for a meal. And once we have funding available, we would send the person to MIFA and they would bring the person into meals. MIFA bills us. That electronic record that we're keeping is uploaded into the MIFA system, and that's actually what they use to bill us. And so it's super important that you keep those records that are accurate, that sort of thing. Because if you deliver a meal and you're not uploading it into the format, MIFA can't bill us for that, and so that becomes a difficulty for MIFA. We conduct on-site visits here annually to kind of make sure they're doing the things they're supposed to be doing. It's called contract compliance, and if you all who've ever written contracts or know about contracts, we do significant contract compliance audits here. And we also really work with MIFA to strengthen advocacy efforts throughout the state of Tennessee, with the state of Tennessee and locally. You guys may have seen Arnetta and I on WKNO recently. That's some advocacy efforts we jointly do together.
How long does it take for that waiting list to rotate? In other words, if somebody's on their position 3,300, how long do they have to wait before they get a meal?
Could be years. It's all dependent on funding.
Oh, yeah, they don't.
It's all dependent on funding.
Probably.
Yeah, so we haven't brought any people in for about the past 16 months. And so you guys have probably noticed that the number of people you're delivering to is dwindling. That's because the CARES money that we received from the federal government is now all spent. And so we'll have about $1.7 million less in our budget next year. That means Mike will probably get about somewhere between 800,000 and $1 million less from us next year than they did this year. And so we've been in the process of lessening the number of people who get meals because we anticipate the loss of funding of the CARES money.
And guys, at MIFA, we've all been looking for ways to cut costs, which is another reason why we are moving to paperless meal delivery.
Yes.
The reason I asked the question about under 60
Yeah.
is because, and it kind of relates to you guys trying to trim
Yeah.
things down. If we notice a client that seems to not qualify, should we
Everyone-
point that out?
I don't know why someone wouldn't qualify.
Uh-huh. Well-
So but here's what I would say. If you notice anything that seems odd, you should notify the MIFA staff. But here's what I would say. If we screen them, they probably qualify. Yep. You guys know these things. Hunger is a real issue in the city of Memphis for seniors. About 20% of the population in the city of Memphis, people are over the age of 60. So these services are much needed and are real contributions to the quality of life of the people you support. Super important. Yeah, growth. You guys want to talk a little bit about some of the growth in the Meals on Wheels program?
Yes.
One we're particularly happy about is the Brown University study. And Arnetta, you want to talk about that?
Right, so, it was asked, and y'all do know this is the third session we've had this week. I want to start off by saying thank you. We hear about all the negative that happens on this, but as Marceline always says, you guys are a bright sunshine.
This is it.
This is it, right? And speaking of brightness, in one of the sessions, we were talking about advocacy efforts, and Kim was on that same, behind the headlines, but you guys have a story, so guess what? Two of your colleague volunteers are going to be on a special segment on Channel 5 at 4 o'clock tomorrow evening to tell the volunteer story. So just want you to know, you all are our greatest advocates as well. So you may hear us coming to you to either ask for a story or be on the news as well. But partnership for growth. Another question was asked, well, how is MIFA? Obviously, we have a great relationship with the Age Commission. So we've been planning this, so we just didn't say, oh, what are we gonna do? Our
We've been
vice
talking
president,
about this for over a year.
over a year.
Because we knew this was happening, right? When you know something big is happening, you plan big, right? And so we've known this for well over a year and we've been planning for well over a year.
And One of these days, I don't know when, Marceline, we may be able to take them on a tour of our state-of-the-art kitchen. You know, state-of-the-art kitchen that's underutilized until now. Over the years, we've tried to establish partnerships, the most recent of which is Regional One, has that same healthy meal. And we actually have that delivered to new mothers and families who need the healthy meals as well as the contact. And that helps reduce admissions into hospitals. We also have the same partnership similar with Laverne Brown University. This is huge. The impact of home delivered meals versus dropship. They're actually doing a study to show what you guys do is more than a meal, and actually hopefully able to get funding from other healthcare entities to show that proactive preventive measure that you guys are doing can actually help in long-term care. There's studies that show that for $2,500, and you guys can read, you know, all about the numbers. For $2,500, it's about the approximate cost of a meal to a senior all year. That's also about the same amount someone pays for a hospital stay and or 10 days in a long-term care facility. So we're trying to get the word out with healthcare partnerships. And we also have a medically tailored meal pilot project through funding through the National Meals on Wheels Association of America. Everybody knows, as Kim said, this is a national movement. The partnership you guys represent is national. So we're trying to show that to our elected officials. And right now we are at the RQ Vincent Senior Center, and we'll actually impact this based on pre and post surveys. So we can talk about numbers all the time, but it's the stories, you guys, that you tell us. And so we appreciate all that you do.
So when you're delivering, you might notice some different people on your route now. You might notice new moms and families. You might notice that families transitioning into housing. So that's kind of what you might be seeing. We also have a Friday opportunity now available. So if you're interested in that, let me know. But it's along the lines of these new partnerships that we've entered into.
False talk. Okay, that's another one, talking about personalized behavior changes, interventions for individuals at risk for falls. That was $5,000 grant. And again, you see, how much does it cost? It's another test. Mention one, she was overlooked test. How much does it cost a meal?
And so, just so you know, the 18th Commission is sponsoring this particular program with MIFA. They're putting it on the Claris tablets, so the people in their homes will be getting this level of programming. We, along with MIFA, have kind of lobbied the state over the past year to establish something called a virtual senior center. And that'll be carried out with the tablets. We'll be the first people in the state of Tennessee to really get that going and do that. And so they're actually changing the rules about what a senior center can look like, so we can get out there and do these virtual senior centers.
Speaking of senior centers, we have 15 what we call congregate sites throughout Memphis and Shelby County. We have drop-off sites at Arlington and Millington, some of the suburban areas, because again, food insecurity is not based on one's income, but rather access to food. So we took this on the road to the exact same presentation to Arlington Senior Center on yesterday. And also we have a partnership with United Healthcare Catalyst Program, in which we provide nutrition education for public housing residents.
I know Marcy Lynn was really committed to getting you guys out of here by 9 o'clock, but I am available for any questions you guys would like to ask me at this point.
We're good. We didn't actually start right at 8
Okay.
due to late arrivals. So we can now open things up to
Yeah.
a Q&A. Yes, Mike.
The new part of that app, where you're trying to assess if somebody, conditions have changed.
Mm-hmm.
I have, one person I've never seen before,
Mm-hmm.
literally never seen.
Mm-hmm.
I talked to her on the phone, or I delivered to her husband. She and her husband both get meals. She's at work, I'm assuming. Is there a thing that not applicable, or, you know, is there anything on that new app that's gonna show up on July 1st?
Change.
There was one on the old app that said, have not seen client lately.
Mm-hmm.
I don't know if there's something else.
Well, I think that all of that would go under personal safety. So if you would just like the personal safety self-care,
Mm-hmm.
and then in the drop-down box, it'll have more details that you can put in there. That's what I think is the best way to do it.
So when it
That-
says change of condition, you're going to select yes. Then you're gonna go under personal safety. You're gonna click that field, right? Then that text box is gonna pop up, and then you're gonna tell us everything we need to know about what your concerns are. And be as detailed as possible, okay?
Okay, I mean, this has been going on, I've never seen.
Then that's what we want to know. So maybe you could give us a month or a year amount, like say, in the year I've been delivering, I have never seen this client. Okay, so as detailed as possible is what we need. And then, of course, we'll follow up with that. Our volunteers are our best indicators of what's going on in the house. You know your people, your boots on the ground. You guys have uncovered some situations that MIFA has investigated. So we thank you for that. We always listen to what you say. Your feedback is very important to us. Any other questions?
Well, go ahead.
Go ahead, Sarah.
Oh, I was just gonna ask, if you could only ask one thing of us about this funding issue, what is the most important thing that you do?
That you would reach out to people who make the decisions about how funding is allocated and let you know.
How many of you have gotten those advocacy sheets on my right? Pass them out to your friends, put them on social media, ask your friends and family.
That's your federal legislature,
Mhm.
that's your highest elected official in this country
Mhm.
who's making the decision to drive a budget. Those are your senators who approve those budgets. Those are your congress people who approve those budgets. You guys may have heard Arnetta and I talk about budget stuff on that thing at WKNO. But there, for example, the ombudsman program in the proposed budget has been zeroed out. So there is a movement that there will be no more ombudsman program offered, right? That particular program is its target of being zeroed out.
So since it's hard to bring them, to come to mind, we actually reached out to their local offices, our US senators, and we've had Senator Marshall Blackburn, Senator Haggerty, Cohen, we've had them, their local officials to actually come to us, take a tour of MIFA. So again, we had this March for Meals campaign where they actually got this information and they're on our email listing and have our telephone numbers and vice versa. So when things change quickly, they have asked us to notify them. So we are being proactive with that effort as well.
But that's the best thing any of us can ever do, is just let people know how we feel about what's going on.
Be the
Is
voice.
this something that, since MIFA is a national organization, we can't grassroots this and fund MIFA here in Memphis for our people with local support versus trying to attack.
So when you say local support, what money do you mean?
FedEx, international paper.
MIFA's asking those
the real
people.
estate companies in town.
MIFA does work with those people all the time, Arnetta, you might want
To
to
the
talk.
tune of about $500,000, okay? So MIFA has a development department in which we have a corporate and foundation officer. And so FedEx and a lot of our local organizations, companies, they actually through grant funding, support MIFA, and then from a fundraising perspective, about $500,000 goes specifically into meals.
And our budget is what? Your budget is what here locally?
Close to $4 million.
Yeah, we send about $4 million a year over here, but MIFA has to fundraise another $5 million to participate with us. Here's something, Arnetta, you may have told them, but we reimburse MIFA $8 for a home delivered meal.
Mhm.
MIFA, how much is it, Arnetta, how much does it cost to produce that meal?
$10.
$10.
So MIFA must fundraise $2 to deliver every meal we fund for them. We are providing them the maximum allowable reimbursement, but it just costs more than what we're able to pay.
But to clarify, thank you for saying it. So MIFA is not a national organization, you know, Meals on Wheels is, but MIFA is local. And someone asked, does all the money come in? Yes, that's only for Memphis and Shelby County. Unlike other organizations, we don't go outside of Memphis and Shelby County at this time.
So the roughly 3,300 who are on a waiting list, is they're on the waiting list mainly or solely because of funding?
Yes.
Or because of lack of volunteers?
Funding.
Funding, okay.
No, we have plenty of volunteers. We've been trying to find ways to keep you guys occupied due to the dwindling route sizes. And then how many of you have said, Marcy Lynn, when I come in, I'd really like to deliver 2 routes. And Marcy Lynn has jumped through hoops to accommodate you happily, because we care about your happiness and your satisfaction. Yes, sir.
I always go with partners, the two of us in the car.
Yes, sir.
And is there a way that the passenger can get to the app?
Yes.
Get to the phone number?
Yes.
Why, I use the app.
Yes,
and
so both of, I'm so glad you asked that question. Thank you. I had it on my list to bring up if nobody brought it up. 2 of you or even 3 of you can be in the app at the same time. Real-time results as you're marking the deliveries. The other one can make the phone calls. It's the person who signs out, and that's the information that goes over to Meals Client Services, okay? But 2 of you can be in the app at the same time, 3, 4, 5. Let's keep it down to not 3, 4, 5. But you know what I mean. So when you log in, the first, you know, the early bird gets the worm. The first person to log into the app, you're gonna get a message when you log in, and it's gonna say, Eddie Mae Parker is signed into this route today. And you're just gonna say, okay, and you're gonna go on your merry way, because it will actually record both of you in, but the person that signs out is the record that will be for that day of who delivered and who signed out. So 2 of you can be in the app at the same time. Yes, sir.
Different,
Sure.
but what if, going back to the, wellness,
Mhm.
I was delivering mail with Sally Mercer
Mhm.
a couple months ago.
Yes, sir.
We called the client, no answer. To go to the door, the front door is open.
Mhm.
The back door is open, dog is barking, there's a car in the driveway, we cannot get the door answered.
Mhm.
Wait 5 to 10 minutes,
Mhm.
5 minutes, maybe we could send it out for a wellness check.
Certainly it would be worth letting MIFA know
Please.
what you
Mhm.
encountered.
Right.
Absolutely.
So you could actually put that, you could do the change of condition.
Personal safety.
And then you could, in that text box, all that
That
information.
just been,
Mhm.
like, that person could have been on the ground.
Absolutely.
So Taisha, why don't you walk them through the process? If they were to select personal safety and if they were to put that information in the text box, what then happens?
It gets sent to the client services team. They put it on my spreadsheet, and probably within like an hour or 2 hours, I've already put in the wellness check. And then probably by mid-afternoon, I'll have a follow-up done.
And that's if you use the app, because it's immediate. That's the difference and why we're asking you to use the app. It's a difference of multiple staff members having to be involved versus just 2. Okay? Yes.
Doesn't record though until we log out of the app, or does it record it? Does somebody see that, say if that were the first one on the route? Would that be-
They can look and see in real time that you're delivering. We've had situations where they're into the app and they're saying, can you check on this volunteer? Because we're not seeing any deliveries and it's 11 o'clock. And it's because the volunteer was using the paper route and they weren't marking in the app. And then they were doing it at the very end. But they can actually track you. They can track you as you're delivering.
But if you encountered this situation,
Yeah.
okay, let's be
Mhm.
clear about this situation.
Mhm.
And you
Yeah.
felt there was an emergency going on,
Mhm.
you should dial 911 and let them know immediately. If you didn't think it's an emergency, but it seems
odd.
like this is really odd. MIFA has a phone. Call them.
Call
them-
office.
Call them in real time.
Call
Don't wait
office.
for something to show up in an app, right?
Mhm.
Because I'm gonna tell you, we've had situations where MIFA volunteers have found people who were unconscious, who have experienced heart attacks, all of that stuff, and the MIFA volunteer has been vital in their survival. So if you feel it, do something about it. Don't trust your instincts. Now, the one thing I would say is, don't open that door and walk in there. But if you feel it's off, say it's off, do something about it. Yeah, be thoughtful about that.
Exactly, it's good.
Anybody?
Yeah, we thought.
I agree with this, not agree, but I have the same situation. I have 2 blind people on my, and one of them, like you were saying, he's under 60. He, completely almost blind, very nice gentleman. I've met him a couple of times, I've seen him, but the same people, his son and his sister come to the door. So I don't see him. Do you guys want me to say, hey, I want to physically see this guy? I mean, how can I say there's no change when I'm not seeing him, but this is not unusual? That's what he says. So wouldn't that be adequate to say no change?
I
If
think,
you, if you do have a concern, just
Yeah.
put it under personal safety, cause I
Yeah.
could always reach out to them and be
Yeah.
like, hey.
But if I don't have a concern, this is kind of what it's been.
If you've
I
never
don't
met the
call
client,
y'all every
if
week.
you've never met the
No,
client,
I have.
okay.
Yeah.
Well, if it's a situation where maybe you used to see the client, but now you're being blocked access to the client, we want to know that.
Yeah.
So exactly what Taisha said, you mark it and you put it in the text box, because we want to know that information, okay?
But to follow up to that, we have the same thing, like, you know, the client, but sometimes the son will come.
Mhm.
If they say they're fine and they're good.
Right.
and-
If it continues to go on though,
Right.
you guys know your
That's what I
people,
do.
right? Trust your
And
instincts.
I'd say sometimes it's one thing,
Yes,
all the time is another thing.
right, exactly,
Right?
exactly.
Yeah, you wanna let Mike
Like,
know that.
Mike, were you the one that said it had been a year and you've never seen the client?
Probably 3 years.
Okay, so
That's the wife thing.
right,
So the number goes to the wife. I think she's at work. I always talk to her,
Mhm.
very nice. And then I go and deliver to the
Yes,
husband.
that's-
So
You
I'm
just
always putting.
You just wanna let Mike know those things.
yes.
Right.
So that would be an instance where
Yeah,
you
never
mark,
seen the wife always.
right,
Yeah.
Yeah. Just
Yes.
let Mike know.
I wasn't gonna ask this question, but I think we're kind of getting in the weeds, but I've had similar situations where every time I go to the house, it's a caregiver that answers the door. I'm assuming the client is bedridden.
Mhm.
And the client's never gonna answer the door, and I'm assuming I'm really not supposed to demand that I go in. the
oh,
house
not
and
at
see-
all, no, no,
That's
so.
a normal situation, I would say no change of condition every time, because that's the normal when I go to that house.
I would say that you could, I would say maybe MIFA doesn't know that information, so you could mark that. Taisha, which category was that one that they would mark if they haven't seen the client?
Personal safety.
Okay, so then, and then just be clear, say, I'm not alarmed. I'm just wanting to let you guys know that for this amount of time that I've delivered, I have never met this client, but maybe they're bedridden. You guys might want to check that out. That's all you need to say. That's not alarming at all. That's just information. Information is what we're asking for.
And just so you guys know, what would happen in situations when you report stuff like that
Mhm.
is Michael would get back to us and they'd say, hey, you know, reports never seeing a person. We're just checking that person's bedridden, that person's this, that person's that. And we'll go, yeah, we'll talk about it.
Mhm.
And if it feels weird, I promise you, one of us will send somebody out.
And volunteers have helped with that in the past. So
Yeah.
again, your information and your feedback is vital. We appreciate anything and everything that you're willing to pass on to us. Does anybody else have any questions? Oh my goodness. Okay, Patty.
I understand that the AG Commission is responsible for the main comment that comes up, right below the directions, above the directions on the printed sheets.
I
Is
have
that-
no idea what that comment is.
Okay, so I've given you information and asked that it be changed and I've been told that, they have to, someone else other than MIFA has to go in and change that information.
Oh, you're talking about when it's a client that's maybe requesting a change in what they're receiving or a change to a cell phone or
No,
changing an
I'm referring to
address?
the comment where, 70% say call the client,
Mhm.
and then some of them have directions.
Oh, you're talking about adding instructions in the driver instructions.
Yeah.
So that goes over to Meals and Client Services and it's their responsibility to then make those changes on the route sheet.
Aging Commission has nothing.
Mhm.
to do with that.
Okay, so.
That's
it's
MIFA.
Within MIFA.
That's MIFA, that's Client
Um,
Services, yep.
Those comments have remained the same basically for years and my opinion is that they need to be updated using the volunteers maybe once a year. Let us, because they tend to be the same and sometimes they are wrong.
That's a good idea. So what she's saying is maybe once a year, we could have volunteers take the information for the different clients and make sure the phone numbers, the addresses, and even the instructions, some of the volunteers will say the house is blue or the roof is red and make sure all of that stuff is accurate. That's a good idea, Patty.
It
We're,
is often.
we'll take that to Meals and maybe we can get that. That's a really good idea. Thank you.
There is the ability in the app, you can put comments in
Mhm.
the app and it shows up.
Yeah.
If you use the app, it carries that forward and you'll
Mhm.
see your comment the next time you log into the app, and it also prints out on the sheet. If you add it into the app.
Ain't that quick? Well, one more quick question. If someone wants, like, they got somebody else in this house that could use that meal, I've been giving them y'all's number, MIFA. Are you saying I should do the aging now?
222-411.
Yeah, okay, I'll
Because
change
if they
that.
call MIFA, all they're gonna do is tell them to call this number.
Okay,
So when I train new volunteers, I advise y'all to add the aging commission into your phone as a contact. And then that way, when you're out delivering, if somebody stops you and says, hey, how do I get on Meals on Wheels? You can pull up the aging commission number right there and give it to them, okay? Oh, I can't see. I'm so sorry, Jane. Go ahead.
The client services team, what does that consist of? Social workers, what y'all got on your client services?
So, the client services team is our data entry specialist. It has, people who work on the routes and put the routes together. And then, of course, me in it as well.
Thank you.
Anybody else? Y'all were a lively bunch. This has been a great training. This has been a great week. Thank you, thank you, thank you.